It's hard for professionals to get rid of their identity as a doctor, as a lawyer. Like, hey, it's okay to take a step back. It's okay to not make as much. It's okay to not see that extra client or that extra patient. Maybe you should go home early and see your family members instead.
If a doctor messes up, somebody could literally lose their life. If a lawyer messes up, not only could you lose your life, you can lose your freedom, you can lose your family, you can lose your assets. So there's a lot on the line on any given day in either one of our professions.
You always feel like you have to prove yourself because you've spent all this time, dedicated all this time to reach this goal. You're never going to want to show people that you failed or are not successful in it. And therefore, you're putting more time and hours to continue to prove it to others when maybe it's not necessary. Medicine,
Law, friendship. This is Dr. Long and Lawyer Nik. You're listening to the Medico-Legal Brief.
One doctor, one lawyer, and a whole lot of gray area. Thanks for joining us again for another episode here on the Medico-Legal Brief with Dr. Long and Lawyer Nik. Today's episode topic, I'm actually quite excited to talk about because it's a hot button topic. It's something that we are constantly talking about, thinking about in our profession, but also something that the younger generation is really taking to heart and making sure that they avoid, which is burnout. With our careers in law and medicine, stress is one of the things that is accepted and known as part of the career choice. I'm excited to dive in here with Lawyer Nik about how it affects him and how it affects me.
Yeah, and Dr. Long, we've touched on this in prior podcasts. You've talked about stressful things in medicine that were your pros and cons in your everyday life of working as a family medical doctor. I talked about why I left the law, but also why I love the law. And then we had one of our very first episodes talking about PTO and benefits. And this discussion was within those other podcasts, but I'm happy that we're having a discussion focused primarily on the burnout that our careers face. And I'm curious to see if we have some overlaps or if there's some things that are very distinct to our own professions.
I'm sure we're going to have some overlap because both in medicine and in law, we are in this unique place where we are not only the experts within our field, but we are also customer service because we have to make sure that our patients and our clients are happy, but also making sure that we follow the rules that are set forth by society and by the laws that we are living in.
Mm-hmm. And essentially, if a doctor messes up, somebody could literally lose their life. If a lawyer messes up, not only could you lose your life if you're looking at a death penalty case, but you can lose your freedom, you can lose your family, you can lose your assets. There's a lot on the line on any given day in either one of our professions. That's a big stress in general for lawyers and physicians to carry.
Is this a topic that has always come up in your career? Did you ever think about it when you applied to law school, going through law school, and eventually graduate from law school? Was this something on your mind?
Not really. Going into law school, you understand that the career as a lawyer is one that is of great responsibility. There is going to be a lot of hard work. There's going to be a lot of hard tasks and a lot of obstacles, and you just have to find your way to work through it. Getting into law school was a task in and of itself. That was hard work. Getting through law school was hard work. And then you're kind of acclimated to the pressures that are going to be coming your way when you're a lawyer. You don't really comprehend and fully understand the level of burnout that can occur. That was something that I came to the realization of as I got older. What about you in medicine?
Similar for me, and I don't know if it's a generational thing, but I really never thought about what could prevent me from reaching my goal. I just knew that this was my goal and I was going to obtain it no matter how hard or how much time I needed to dedicate to it, because that was always the goal. It was understood that I was going to be spending the first 4 years of medical school grinding, and then 3 years of residency seeing as many patients as I could so that I can learn as much as I could. And I knew that those were the sacrifices that needed to be had. I never really thought about what sort of sacrifices in terms of a health standpoint, a sleep standpoint, a financial standpoint. These were all sacrifices that I really didn't think about going through the process. But now looking back at it and comparing it to my colleagues who were not in law, not in medicine or other career choices that were higher education where they required several years beyond college, comparing myself to them now, it's like, well, was it all worth it? Most days it is. Some days, maybe not as much.
Of course, lawyers like to analogize. We like to use analogies where we can. When you're young, you're naive. You don't really understand what the job is going to need out of you, what you're going to have to sacrifice, as you just mentioned. So good analogy, when you are single and somebody tries to describe marriage to you, whether it's the pros and cons, you really don't truly comprehend. Just like when you don't have kids and then you have kids, somebody can tell you what it's like raising kids. And if you don't have kids, you don't really have the full comprehension of what it's like to raise a child, what it's like to wake up in the middle of the night to a screaming baby. You just don't really recognize what that entails and what's needed out of you until you're in it. And then at that point, you start to have a full appreciation of what is actually occurring and what you actually need to sacrifice. It's the saying of, if I knew then what I knew now, then life would be a little bit different. That's extremely true given our career paths.
I touched on some of those things that I started to come to recognize as really big stressors and burdens to our lives. What have you noticed, or what have you seen now that you're looking back on your career? What were those stressors that lead to burnout during the process for you?
It's funny because I kind of just mentioned them in a hidden way. Being single and then getting married, that's a stress in and of itself. Having kids is a stress in and of itself. When you're younger, you have the mentality that you can take on the world. When somebody explains to you, hey, you're going to be working 50, 60 hours a week, you don't really comprehend what that is because you have all the time and energy. And if you're not responsible to another human being, then all that time and energy is yours to own. If you choose to work that long, if you choose to put in that many hours, that's on you. But when you start throwing in the dynamics of a partner, then you have to start taking into consideration your relationship with that human being. How many hours are you going to work versus how many hours are you going to spend with your significant other? Same thing with kiddos. How many hours are you going to work versus how many hours are you going to spend with your significant other versus how many hours are you going to spend with your kids? Just life in general starts pulling the amount of focus you have on one thing. If you are not balancing your time correctly, or if you have poor time management, one of those things start to fail. Usually the job is the first one to stay because it's easier to put all the other things off, whether it's not paying attention to your kids for 20 minutes or missing a date night with your spouse. The job stays, and then that adds to the stress, and that just keeps building and building. And now that I'm older, I understand that myself needs to be split amongst multiple priorities. That's kind of been an awakening over the years.
I couldn't agree more. The one thing that a lot of people who maybe are thinking about a career in medicine and law don't realize is that when you spend so much time in this to get to where you want to be, it becomes your identity. When it comes to the day you're having to decide on your priorities, sometimes it becomes the main priority when it maybe shouldn't be. That can be a huge stressor and a big burnout, because then you always feel like you have to prove yourself because you've dedicated all this time to reach this goal. You're never going to want to show people that you failed or are not successful in it, and therefore you're putting more time and hours to continue to prove it to others when maybe it's not necessary. I totally agree that when you get into relationships, when you have a kid, sometimes it's hard for professionals to then get rid of their identity as a doctor, as a lawyer. Like, hey, it's okay to take a step back. It's okay to not make as much. It's okay to not see that extra client or that extra patient. Maybe you should go home early and see your family members instead.
And the sad thing is, our careers, our companies, our law firms, our corporations, they actually encourage that to some extent. They encourage I don't want to call it bad behavior, but they encourage that type of behavior because you get awarded bonuses if you work the extra hours. If you're sending the late night email, you're part of the office talk of, wow, he's really putting in the work and he's putting in the time. You're just rewarded for the behaviors. When you go to work, you're appreciated, you are applauded, your reviews reflect it. And then, of course, the dollar amount, whether you're getting a bonus or an increase in salary, also reflects it. When that's encouraged, it's hard to step back, especially when you as an individual can justify, well, this is for my family. I'm making money for my family. I'm paying attention to my career for my family or for my wife or for my husband or for my kids or for my spouse or whoever. It's easier to justify that in terms of monetizing it. And when the company or firm is rewarding that behavior, it's hard to step back because then you're compared against your peers. And if your peers are doing it and you're not, then you start seeing that you're being penalized for that action.
It's not just incentivizing, but it's just the way the system is built. The more you work, the more money you're expected to make. But again, that prioritization of when you start having more people that you're supporting, that check that used to only be for you as a single person now gets split amongst a spouse, couple kids. You're not going to have the same expenditures. And with life creep, whether we started out in an apartment, now have a home, a new car, these things all build up to more debt, more expenses. And so it then forces you into this hamster wheel where you constantly have to keep working. Otherwise, you're not going to be able to pay for the lifestyle that you have created. It really just lends to that burnout. But the younger generation, especially Generation Z and below, they've really honed in on this idea of work life balance and just trying to keep work at work, home at home, and trying to split it in not necessarily a 50-50 manner, but in a very individualistic manner where it's helpful for them to continue to work in that career long term. The conversation really isn't a conversation these days when you're talking to a Gen Z physician. They will tell you, this is the time I clock out. I'm done. I'm leaving. And that is something that would be almost looked down or frowned upon with our millennial class and anyone older than us. But I applaud them for it. And I'm working towards getting that sort of same mentality. I'm curious whether or not you have the same thoughts.
I'm right there with you. Obviously, in my different career paths, from being a lawyer to working as a manager at Lockheed to now doing real estate, I've had the ability to see many different aspects of having people under me, having people in a department, how human resources, HR works. And when I started in corporate, I was pulling my work ethic from being a lawyer, where it's you work hard, you put in as many hours, you don't really take a lot of time off. If somebody asks you to get something done, you say, yes, I'll figure it out, and you get it done. And I remember the first time I asked my manager if I could take PTO, it was a formal request, almost like I was begging for PTO, saying, hey, I have this. It's in 3 weeks. I would really like to take PTO. Is that going to be okay? What do you need me to do? Blah, blah, blah. And his response was, hey, you're a professional. Just take PTO. Then when I became a manager and I had the younger generation asking me for PTO, there wasn't groveling. There wasn't begging. It was, hey, just to let you know, I'm going to be taking PTO and I'll be gone the entire day. No explanation, no justification, just a, hey, I'm taking off. And from my point of view, I accepted that because that was the appropriate thing. I'm evolving with the times. That is the only thing I need to know. I don't need to dive into the detail. I don't need to question them. But it was consistent across all the newer generations coming in the workforce when all the older generations had that tough time not justifying, just going through and taking the PTO. So I completely agree. Generations coming up, they protect their work-life balance. And I wonder if it's because they see what we are going through and see what the generations before us, our parents and our parents' parents went through. And they say, that's not going to happen to me. I'm not going to be taken advantage of. I'm not going to be overworked. I'm going to keep my mental health and my mental state healthy. That way I can continue to live the life I want to live.
And if we have any Gen Z physicians and lawyers out there, I'm actually curious to see what your thoughts are because I want to know how you guys are able to compartmentalize that. Because when I take PTO, yes, I know it's needed. I know it's needed for my mental health. But the thing I worry about is the guilt that I have for having to cancel full days of patients, especially if it's like a last minute PTO where my kids are sick and I have to take off. I feel so bad that I have to reschedule all these patients and they already set up this time to come see me for whatever issues that they had. And now this has to be adjusted and it's throwing a wrench in their schedule. But I know that ultimately what could lead to burnout is me not taking that time off. But then also me burning out is feeling guilty and feeling like I need to work harder for my patients. And so it's this weird dichotomy where you're always struggling no matter which way you look. You're always going to be struggling on whether or not the decision you're making is appropriate and whether or not it's going to be helpful for the people around you.
I don't know if you've done this, but I'm very guilty of it. I've taken vacation, whether it was a quick weekend trip or a long 2-week excursion, and I have brought my laptop, my work laptop, or my work phone. And during that time, I have checked emails, I have responded to things, I have helped out, I have made phone calls. And my wife points it out. Why do you need to bring that? You're off work. You have people that are in place that can manage what's going on while you're gone. But I'm wondering, are you also guilty of that? When you're on vacation, are you looking at your phone? Are you looking at your laptop and still kind of on the clock working?
Yeah, it's bad for me. My husband points it out all the time. But for me, it's a little different because I have an inbox that needs to be monitored. And sometimes other people don't monitor it as closely as I would monitor their inbox. And there are things that get missed. And so I don't want patients to have an emergency and it get missed. So yes, I am checking. I am getting better in terms of how much time I'm dedicating into it. Maybe I only spend 5 to 10 minutes when I'm on the toilet and take a quick look on my phone. I usually do not bring a laptop. I actually don't really own a laptop. I utilize whatever I can on my phone and I only do maybe 2 to 3 5-minute sessions a day when I'm on vacation. So I've limited it, but yes, Absolutely. When I first came out, I was checking it all the time. I was making sure that patients got their timely messages. And now I realize most of them don't even notice the difference whether it's coming to them in 12 hours versus 24 hours versus 48 hours. Now, if it's more of an emergent case, usually patients know to just go right to the emergency room.
That's something that's a very detailed, nuanced note. You might work your ass off to get that message out. You might be stepping away from your kids at the pool or your husband at dinner to make that text message. But the realization is the work's always going to be there and they may not even receive it. They may not even pay attention to it until the next week. I remember working at Lockheed, and this was a struggle for me. It was Thanksgiving and something needed to get done. We needed a contract that needed to get out. I needed to do my evaluation and a final memorandum write up. And for whatever reason, on Wednesday, the government came in and said, you guys don't have this in the file. We need this in the file by Friday. And obviously Thursday was Thanksgiving. So on Thursday, I worked my tail off to get this memorandum done. I ended up submitting it. It got approved. We were able to meet that deadline. Friday, I shoot out an email and I just say, hey, did the government receive it? Are we good to go? This is the deadline they gave me. And the email I got back was, they're all on vacation. They won't get the email until Monday. And my response was, why did I work so hard on a holiday to get this done if everybody else knew that it wasn't going to be for them to review until Monday? It's those things that you grow with and you learn from that show you, hey, the work's always going to be there. Obviously, there's deadlines for certain reasons and certain things. I'm not saying to negate deadlines, but there's certain circumstances where it doesn't really matter. You have to be able to register what is truly important in that moment and the things that can wait. That's part of growing and acknowledging the burnout and how to deal with it.
Mm-hmm. A parallel to that sort of topic is client reviews. It's something in law and medicine, something that we constantly have to deal with is people leave reviews, whether they've seen you or not, whether they've heard from you in person or just a message, they will leave a review on Google as a way to either badmouth you or hopefully help you in the long run. What are your thoughts on that? And how do you think that that stresses you out or leads to burnout for a lot of physicians and lawyers?
Man, it is a stress point. Building on what you've said, you have all these little things that lead to the burnout, whether it is being overworked, whether it is the stress of not leaving your peers on an island, whether it's the stress of you trying to check in on your clients or your patients while you're on vacation. All those little things add to this stress bubble that is the burnout. Anybody worth their salt who wants to do a good job, the reviews in this day and age is a stress point. Making sure that you have the good review, that way you're doing right by your clients, but also understanding that the bad reviews come in. We do it on this podcast. We look at our reviews. We look at our likes and our dislikes. And if there is a dislike, you and I sit down and we try to talk about it and try to figure out, where did we go wrong? Was this just a person who was pissed off at the world and we're just their target for the day? Or is it truly something to consider? And when you look at sites like Google or Yelp or your own hospital website with reviews or your own law firm website with reviews, those things are very stressful because once you get a negative review, you're trying to go through the analysis of how did this happen? Is this feedback something I should take into account? And that takes up time. That takes 20, 30, 40 minutes of your day. And then sometimes it might be for an entire week, depending on what it was, until you forget it and move on with your life. I love the system with reviews because I use it so often for myself to pick and choose who I work with and who I go with. But the stress of being negatively reviewed is something to mental health as a professional.
Yeah, and in medicine, it's a unique stressor because it actually can lead to patients dictating their medical care. It may not be following guidelines that are laid out. It may not be following the actual appropriate treatment plan, but because the physician or the clinician that is treating the patient is worried about a bad review, they're more likely to be inclined to listen to the patient and be like, okay, I normally wouldn't prescribe this antibiotic or this particular medication at this particular time, but because I know you're going to leave me a bad review, I'm just going to give it to you. And that may or may not lead to harm down the line. That's a very unique issue that in medicine we deal with all the time. And it's not just the emergency room, the urgent cares, your family doctor, but specialists as well. Patients coming to the surgeon usually are expecting some sort of surgery. But if the surgeon says, hey, I don't think this is appropriate, some patients don't like that answer. And so some surgeons feels like they have to do surgery when a patient comes and is really pushing that perspective. It's hard to live with. It's something that we're constantly having to deal with. But the one thing that I want to then lead into is that I wish there was some way that we can review the health insurances because they are truly the ones that give us such a headache in medicine. And yet patients patients know it, they talk about it, but there's no real way to leave a bad review for health insurance.
Tell me more about that because obviously I've dealt with shitty health insurance companies, either looking out onto the marketplace for private insurance or being given insurance via my employer. Tell me about the feedback channels the insurance companies get. Do they even exist? Because I feel like reviews are big feedback channels. When you're able to leave a review, it's out there for the world. You have to own that review and figure out your way around it. But insurances, I don't really see any big reviews, especially when I feel like there's not a lot of choices out there.
It's because there are a lot of choices out there. And the issue is the choices are made based on your income level. If you're not able to afford better insurance, you're going to get shitty insurance. And that's usually the case when we're dealing with these insurance. And we know that, hey, this patient's coming in with this insurance, it's going to be very restrictive. If they have diabetes and high blood pressure and there's particular medications that would be absolutely life-changing and extending their life, but we know that it's not going to be covered. It's a very hard discussion to have with the patient and letting them know, hey, you have this insurance. They usually don't cover it. We're 99% sure they're not. We'll still send it through, but just know that we're probably going to have to pick a second or third option that is just not going to be as good as that first option. So again, this is people's lives that we as clinicians and physicians, we're having to navigate and make sure that the patient is appropriately managed, but also making sure that their pocketbooks are also saved and that they're not overly spending on things that are not necessary.
And I'm sure you're sitting there in the room with them saying, don't shoot the messenger. I'm just the bearer of bad news. I want the best for you, but your insurance company is what's the obstacle in this situation. And then in that moment, you're the one that gets yelled at. Your staff is the one that gets yelled at. You have to manage emotions. You have to play counselor. You have to figure out how to navigate that situation. And then you have to go back to your desk when you have a stack full of patients to try to then figure out how can you get past this. We've talked about it on different podcasts. You have to then make phone calls, call up the insurance company, have a discussion with their physicians, with their administrative people. And it's a whole process that you don't necessarily get paid for and takes time away from your day and your patients.
Exactly. And you guys should find those other episodes where we do have that in-depth conversation. But yes, that's something that we deal with all the time. And struggling with prior authorizations, peer-to-peer conversations, time that is taken away from patient encounters. There's already a shortage of clinicians out there taking care of patients. And so these sort of issues only take away more. And it's funny because when I send a medication to the pharmacy, I have no idea how much it's going to cost the patient. The pharmacist will know. They'll know within 2 seconds as soon as I send the prescription. But then the pharmacist can't do anything about it if it gets denied. They have to then send it back to the physician who has to then pick another medication and then send it back over. And then the pharmacist can then recheck. And if it's still a medication that's not appropriate, they have to send it back. There's got to be a better way to connect all of that. And I'm hoping that some of our younger generation legislators and physicians out there will find that better program and that better system so that once I put the medication in and you already know what the health insurance is and we know what the coverage is, can you just pop out the exact number, the exact cost that it's going to be once the patient goes to the pharmacy? It would save so much time, so much burnout from everyone involved.
Now, we've talked about burnout from hours and taking PTO. We've talked about burnout that comes from our responsibilities with family and kids. We've talked about burnout of review. In the physician or medical world, is there something that you identify as burnout that may not be in the traditional sense considered burnout? I have a pretty good one for law, but I'm just curious, is there something that nobody really thinks about when they think about physician burnout that you're like, this is a real thing and this is actually something that exhausts us to the max?
I think monotony or seeing the same thing all the time is probably something that a lot of physicians struggle with because it is a career that they choose and then they choose a specific specialty and they're stuck in it for the rest of their career. They're not able to transition out of it like other clinicians, like physician assistants or nurse practitioners. Once you go family medicine, you're always going to be a family physician. You're not going to be able to then become a dermatologist or a surgeon. If you are not in it and you're not enjoying the type of medicine that you're practicing in that specialty, it can become really old really quickly. And then again, adding on the requirements of seeing a certain amount of patients per day, it really just adds on how quickly you can burn out and how short-lived that career can be. And a lot of physicians in our generation are leaving medicine and doing non-clinical work because they're just no longer enjoying the clinical side of it all.
You know what? I just had something that clicked from years ago. I was seeing my PCP and I had like a cyst on my arm and he looked at it. He's like, yeah, this is just a cyst. And he basically said to me, hey man, look, I'll level with you. I would refer this out to a specialist to have you see a surgeon. He can go in, he can make it look very pretty, cut it out. He'll handle it that way. Or if you want, I could just take care of it right now. I'm not promising that it's going to be the prettiest of cuts, but I know what I'm doing. I've done this before. I can cut it out, local anesthesia, I can remove it. You'll be done within like the week. And I thought, yeah, the convenience is there. That's perfectly fine. And now that you're talking about that, I'm like, he probably just wanted to break up the monotony of his day where he's thinking, well, this is something I don't get to do all the time. I'm fully capable of doing it. Usually I have to refer this out. But if this guy's not caring about a scar and he trusts me and I know what I'm doing, and I'm capable of doing it, then why not see if he'll let me do it? And sure as shit, I let him do it. And he did a fantastic job. I didn't have to go see a specialist. But now that you're talking about that, I look back and I see there was probably some reprieve there where I broke up his day. He got to do something he doesn't get to do a lot. He got to do some stitches and he got to do some cutting and he got to pull in his nursing staff or his PA staff to see something that they probably don't get to see all the time.
Yeah, I'm very open and honest with my patients. I tell them all the time, hey, I am so glad you're here because you are changing my day because we get to do a procedure rather than me doing a whole bunch of annual physicals or going over anxiety, depression, or going over ADHD medications all the time. I am very open because I want them to know that I enjoy it and that they know that I am a resource and we can do it right away, quickly that day rather than waiting to see the specialist. But I'm now curious to hear what your parallels in law was. There was something that you wanted to discuss.
But the thing I think that a lot of new lawyers don't really understand when they get into being a lawyer is the social pressure to be an extrovert, the social pressure to go to happy hours, to go to golf tournaments, to make sure that you're showing out not just in work and during normal work hours, but you're doing the extra to basically shake hands and kiss babies. Now, granted, a lot of lawyers go into politics, but there is a lot of politicking that takes place at your law firm. When a happy hour happens, you almost feel pressured like, okay, I need to go to the work happy hour. I need to go to the dinner. I need to go to the function. There's an award ceremony. I need to be at the award ceremony. I know we've talked about it. I'm an introvert. You're an introvert. We do have these extrovert characteristics where we enjoy doing things with people, but I always dreaded those things. I still dread them. I dread a networking event. I hate going to them. I would rather do so many things with my time, but the pressure that exists to go have a beer with your peers after work and then end up staying out late because you feel pressure to stay with the senior partner till 9 o'clock until all the beers are finished. And then you got to get home, do your thing, sleep and wake up at 6 o'clock in the morning. That social pressure does exist. A lot of people, at least introverts, don't really take that into account when they're looking for the jobs at the law firms.
I think that would be a great deep dive in another episode where we go over introvert, extrovert, and how that plays into our social lives as a physician and lawyer. And if our audience wants to hear more about that, let us know down in the comments because that would be a really cool conversation to have and knowing whether or not introverts can thrive in these sort of careers. But I want one last thing to hear from you. 1 or 2 sentences about what did you do to help prevent or decrease your burnout in your career path so far? Because it does not seem like you're burnt out at this point in time.
I left my job as a lawyer. That's what I did. And you guys can hear that story on our other podcast, but I left my job as a lawyer. Not to say I don't miss being a lawyer, not to say that I don't do other things that are lawyerly, but that was one thing where I had to have a true introspective moment on what makes me happy and what juice is worth what squeeze. And so that's where I ended up leaving a family law attorney position. What about you?
So I actually really love family medicine, but the things that I have done to decrease my risk of burnout is 1, making sure that I get rid of any sort of golden handcuffs. So we call golden handcuffs anything that requires us to stay at a job. And that's usually because we have a lot of student debt. And so for us to pay off our student debt, there's a lot of incentives that employers will give, and you have to work there for a certain amount of years to then get your loans paid off. I have gotten rid of that and no longer have to worry about it. And so I can choose my job, my employer, based on whether or not I just like working there or not. And it's not about the money. The other thing I've done is making sure that I've spread myself across several different opportunities where every single day is a little different. So for me as a family physician, I'm working in my own personal clinic, seeing my own patients. I'm working with residents, teaching them in the clinic setting as well as in the hospital setting. And then I'm also doing a little bit of hospice work on the side. These are all things that change my day-to-day look. Therefore, I never really get bored and it never feels like a monotonous day because I know that the next day it's going to be something different. And I'm turning on a different light switch in my brain to enjoy something different about medicine.
And I appreciate those because although mine was a little bit simpler and a little bit more crass as to just leave your job, yours are more applicable across many different positions, finding the different opportunities to avoid monotony, making sure that you're not having those golden handcuffs that attach you to your career and that you can free flow and not be almost a slave to your job. But with that, I definitely appreciate this conversation. We have many other themes and categories of podcasting that come out of these conversations, and we identified several here. If you like what you've heard, go follow, like, and subscribe. We're on Spotify, we're on YouTube, we're on Instagram, we're on TikTok, we're on LinkedIn. We have our episodes every Wednesday at 10 a.m. Central Time. Join us in conversation, and we look forward to seeing you again. Yes, we're doctors. Yes, we're lawyers. No, this podcast is not medical or legal advice. Do not take anything we say as a reason to perform your own heart surgery, represent yourself in court, or diagnose your neighbor's rash. This is for entertainment only. Think of it like hanging out with your smartest, wittiest friends, not a substitute for an actual appointment. If you act on anything we say without talking to your own professional, that's on you. Seriously, don't do that.